Good afternoon, everyone. I hope everyone can hear me okay. My name is Emily Duran. I am the CEO of Kern Family Healthcare. And this afternoon, I would like to welcome you to the informational session on the Medicare Dual Special Needs Plan. This will be a co-hosted presentation between Kern Health Systems and the Department of Healthcare Services. Next slide. Just a few items to go over on our agenda. Again, welcome, and I'll go over some housekeeping comments. And we want to start by giving you a brief overview of who we are as an organization, Kern Family Healthcare. And then we have invited Anastasia Dodson, who is the Deputy Director at the Department of Healthcare Services, who has also been instrumental in helping Kern Family Healthcare with the implementation and oversight process in developing a D-SNP program. Next slide. Just a few components. This meeting is being recorded and it will be made available on our website. Please hold your questions to the end. Feel free to jot them down and we will have the opportunity to send in your questions and we will provide answers. And all attendees will be muted. Next slide. As a brief overview of who we are as an organization, Kern Family Healthcare is the local health plan initiative. We have been in existence since 1996, and we currently service over 406,000 members in the Kern County. We are very excited to be the largest plan here locally, but we also take that very seriously. That means that close to almost half of the population in Kern County, actually 56% of our community members rely on Medi-Cal. And we as a health plan are very concerned with their health. We want to ensure that we have the appropriate access to care. We want to ensure that we have the appropriate network for our membership. And we want to ensure that they are receiving the right care at the right place. Next slide. I would like to bring to your attention just a few things that tell you really who Kern Family is. Our mission and our core values are instrumental in guiding not only what we have to do as a health plan by regulation, but also what we do as a community partner. Our mission is to obviously improve the health status of our members, and we want to ensure that they have the integrated care between their mental health, their social determinants of health are addressed, as well as ensuring that they have access to the best providers in our community. And we have a wonderful group of providers that help us during the time of need for our members. Our core values are excellence, integrity, collaboration, equity, innovation, and compassion. And we feel that these core values are what actually drive our overall mission and our roadmap to providing care for our members. Next slide. As a brief overview, and the reason for this session is to allow our provider partners, as well as our community partners, to help us develop the best dual eligible health plan that we can. As of January 1st, 2026, Kern Family Healthcare will be a D-SNP provider. So what does that mean? It means that those individuals that are dually eligible for both Medi-Cal and Medicare are actually can pick Kern Family as a health plan. Enrollment is obviously voluntary. It's not automatic. People are not automatically enrolled if they have Medi-Cal with Kern Family Healthcare. They're not automatically enrolled, so they have to actually choose to enroll into Kern Family's D-SNP program. Therefore, provider participation in our overall D-SNP is very important. Although it's not mandatory, we have had tremendous response from our provider community and have already initiated our contracting process with all of our provider network. And we greatly appreciate all the work and the interest and the support that our local community has provided to us as a health plan. We want to ensure that, we do have this strong provider partnership because it's very essential in creating a very successful D-SNP program in our community. Next slide. Our values, you saw some of our key core values, but we also like to promote the integration that we have within our community. Obviously, our not only our community-based organizations, but also our provider, they play a key role in providing the necessary support for our members. Individuals enrolled with both Medi-Cal and Medicare who already access Kern Family Healthcare will again be eligible for the dual eligible program. And currently within our population, we have approximately 25,000 members that qualify. So what does that mean? That means that, again, we will have to provide this information to our membership to ensure that they know that Kern Family is also now a dual eligible plan. And we want to ensure that both our community partners and our provider partners are here to help us along the way. As of today, again, we are developing the process and the infrastructure for our dual eligible plan. And we are very excited to really collaborate with our member and our community and providers. Next slide. Just a brief overview again of our values. Our members, our community, our providers are key to ensuring that we coordinate access to care for all of our members. We are going to make this as seamless as possible for our members. Our members do experience challenges. They do have many social determinants of health. And with that in mind, what we are trying to do is ensure that our providers and our community-based organizations are partners with us, because we want to ensure that they are taken care of from start to finish. We will help with the onboarding of new providers. We are going to be eventually, announcing and allowing the members to enroll as of October of this year. And within our community agencies, also we depend on their support to ensure that we are providing community-based services that our members need. Next slide. So where we are today in the development of our D-SNP program, we have again already engaged our providers to enhance our D-SNP network. And again, we've had overwhelmingly positive responses. We have our provider community eager and ready to be a D-SNP provider. We are providing education to our community stakeholders, again, on the importance of a D-SNP, because if you think about this population, the D-SNP population has, in most cases, more barriers to overcome, and we want to ensure that we are sensitive and very empathetic with the needs that they currently experience. And we want to make sure that, again, it's a very seamless process for our membership. We want to ensure that we are emphasizing that coordination of care between the provider, the social workers, our community partners, and the plan. And we want to ensure that readiness in the program is achievable, and we will be ready for our annual enrollment in October of 2025. So we are very excited to launch this program. And again, it's been a lot of work in progress, but at the same time, I think we will see a very complementary service delivery model with our current network that we have established for many, many years. And we greatly appreciate the partnership that we have with our provider community. We greatly appreciate the community-based organizations that have been extremely supportive of the extra services that we have been providing. And we want to develop the best D-SNP possible to ensure that those members that need it the most have a great experience and can really address their health. Next slide. With that in mind, we had a brief overview of who we are as an organization and Kern Family Healthcare. And with that, I would like to introduce Anastasia Dotson, who again is a Deputy Director at the Department of Healthcare Services, Office of Medicare Innovation and Integration. Anastasia?
Thanks so much, Emily. Great to be here, and nice to, see such a great turnout. What a lot of people. That's wonderful. Okay, great. Well, I work at the State Department of Healthcare Services, and my team works on topics related to people who are dually eligible and D-SNPs. Next slide. So we're going to talk about D-SNPs, and we call them Medi-Medi plans at the state level. That's kind of a generic term, but you'll see where we talk about D-SNPs, Medi-Medi plans, and then even specific health plan names like Kern. All right. So we'll talk about dual members, we'll talk about Medi-Medi plans, and then what to expect ahead for the open enrollment on the Medicare side coming up. Next slide. All right, next slide. Okay, great. So, of course, Medicare and Medi-Cal are both very big programs. They serve a lot of people, and they are separate programs, but some people have both Medicare and Medi-Cal. Sometimes they're called Medi-Medis. I know sometimes that term is for people that are in original fee-for-service Medicare, but we sometimes just say Medi-Medis for anybody who's got both Medicare and Medi-Cal. Anyway, Medicare covers doctor visits, hospital stays, prescription drugs, many other things. And then for these folks, Medi-Cal is important because it covers their Part B premiums, their co-pays, adult day health or CBAS, skilled nursing facility care, dental, and IHSS, in-home supportive services. So both programs provide important care and benefits for people who are dually eligible. Next slide. So also for people who are dually eligible, one thing we see in the data is that they are more likely than people who just have Medicare. They're more likely to report being in poor health. They do have significantly higher rates of chronic conditions like heart disease, hypertension, diabetes, depression, dementia. And you may already work with this population and you may already know that, but just validating that it's in the data. And that group also is high utilizers. They use, a lot of different service providers. They're down at the bottom, you can see among everybody who has IHSS, about 75% of that IHSS population is dually eligible, and 80% of the folks who are in Medi-Cal skilled nursing facility care are dually eligible. It's a diverse group though, because 25% are under the age of 65, and about a third have limited English proficiency, which is a higher number than in the regular Medi-Cal population. So at any rate, this is just a quick snapshot. We'll go to the next slide. Okay, so across California, in all counties, there are 1.7 million people who have Medicare and Medi-Cal. And statewide, not specific to Kern, but statewide, about half are enrolled in some type of Medicare Advantage plan, and about half are in original or fee-for-service Medicare. That's where they're at on the Medicare side. On the Medi-Cal side, all people who are dually eligible are enrolled in a Medi-Cal managed care plan. So again, on the Medicare side, about half are in original Medicare, half are in Medicare Advantage, but for Medi-Cal, they are all enrolled in a Medi-Cal managed care plan. Next slide. This gives you just a little visual, again, to think about that half, and this is about only Medicare for duals. And I think anyway that the dark blue, I don't know why the labels kind of disappeared there, but the dark blue is showing how many, the proportion that are in original Medicare, fee-for-service Medicare. And then that lighter blue, the 19%, is those who are in a Medi-Medi plan. And that's what we're going to be talking about in the rest of these slides. So that's quite a bit. And one of the points I want to make is that Medi-Medi plans are already up and running. In fact, they're serving 330,000 people already in California. So it's not something that's sort of a pilot. It's up and running, it's here, and it's coming to Kern County. There are also among dual eligibles about 18% that are in a regular Medicare Advantage plan. So dual eligibles have a lot of choices. They can be in original Medicare, they can be in a Medi-Medi plan, a type of D-SNP, they can be in regular MA, and there's other options too, including PACE and other special needs plans. Next slide. So again, about a little over 40,000 people who are dually eligible for Medicare and Medi-Cal in Kern County. And as of January, about 19,000 were in Medicare Advantage. And that's actually really close to that statewide average of a half. 19 divided by 40, 41 is almost half. But just FYI, what we see in other large Southern California counties is that there's more than half that are in Medicare Advantage. But then in certain rural counties and other Northern California counties, there's quite a bit less than half that are in Medicare Advantage. So anyway, a little trivia about different counties in the state. Next slide. So let's talk about Medi-Medi plans, which again, what Emily was talking about with the D-SNP. So why are we doing this? Well, Medicare and Medi-Cal, they are separate programs and they do operate separately. Different funding streams. Medicare is a federal program. Medi-Cal is a state and federal program. But it can be very confusing and hard to navigate for people, especially, and it can be hard for providers too, when there's, things that overlap across both sets of benefits like durable medical equipment, skilled nursing facility care, and then making sure that, we have all these wonderful benefits that we've launched in recent years on the Medi-Cal side, but community supports, enhanced care management, but how does that relate to the Medicare piece? Having one organization that has visibility in both sets of benefits can really be helpful for coordinating care. Another pain point is dental, and we've had excellent results from Medi-Medi plans in increasing people's use of dental services. Okay, so having that solution of a Medi-Medi plan, it is part of CalAIM, which you've probably heard of, coordinating care across Medicare and Medi-Cal. These plans already exist in 12 counties. You can see the list right there. We already have enrollment of 330,000. And these Medi-Medi plans, there are going to be additional plans like Kern in 2026. Next slide. So this is under the hood a little bit. Medi-Medi plan, again, it's a generic name, but they are a type of Medicare Advantage plan, but they're only available for people who are dually eligible. And on the technical side underneath, there's the D-SNP, which is a Medicare contract where the health plan has a contract with Medicare and they provide Medicare benefits through that D-SNP contract. And there's also the Medi-Cal contract that the health plan has with DHCS, but it's that same organization that has both contracts that provides that integrated care. So that orange block there on the slide, we try to remind people it's a D-SNP plus a Medi-Cal plan. Together that makes a Medi-Medi plan. And as Emily said, enrollment is voluntary. Next slide. So we use the name Medi-Medi plans, sometimes Medicare Medi-Cal plans, but each health plan that's launching a Medi-Medi plan, they have a plan specific name that they use in member materials. Another really important point is that Medi-Medi plans are described as a single plan for the member, so that there's one card, one welcome packet, one phone number to call for member services, one phone number for care coordination. We have a lot of resources available to describe this in greater detail on our DHCS website. And we also list the specific plan names for 2025 in case you're curious. And again, Los Angeles, San Bernardino, Riverside counties, San Diego, Orange, they've had Medi-Medi plans for several years now. Next slide. Obviously, this is a map, and you can see in orange, those are the counties that already have Medi-Medi plans active, and it's Southern California, some Central Valley and Bay Area counties. So then the dark blue, that's where Medi-Medi plans are going to be launching in 2026, including Kern Family Health. And then there's the far north, that's going to be phased in a little bit later, and the polka dot is just where there's only one Medi-Medi plan and the other one will be launching in future years. But you can see there's Kern in the dark blue there, and yay, Medi-Medi plans are coming. And again, voluntary enrollment. Next slide. This is a visual of the care coordination requirements. These D-SNPs, the Medi-Medi plan structure, is actually a federal model that is used in other states as well. And one of the main requirements from the federal government for these types of plans for Medicare is that the health plan has to coordinate all benefits, even the Medi-Cal benefits, so that there's one organization coordinating across all Medicare and Medi-Cal benefits. Durable medical equipment, for example, part of it's covered by Medicare, part of it's covered by Medi-Cal. They must coordinate across both sets of benefits. Same with nursing facilities and long-term services and supports. The organization, the health plan organization, has to coordinate across both sets of benefits. Most of the other pieces you see on this wheel are either all Medicare or all Medi-Cal, but again, a care coordinator who's looking across all of that will coordinate all of it. The other piece I want to mention is that in Medi-Cal, Cal-AIM, we've had a lot of work on launching enhanced care management, ECM, and that enhanced care management is very similar to the care coordination model that the federal government has set for Medi-Medi plans. So to avoid confusion, to avoid duplication, the Medi-Medi plans, the D-SNPs, they provide very intensive care coordination, so there's no need for enhanced care management on top of that. So, but just to make sure that we put state requirements in on top of the federal requirements, we call it California Integrated Care Management, but it is intended to provide the same type of benefits that members can get through enhanced care management on the Medi-Cal side. So we have less duplication, more streamlining, less confusion around care coordination there. All right, next slide. So you may be wondering about things like IHSS, county behavioral health, dental, where that's not part of the benefits that the Medi-Cal plan administers. So for IHSS, I want to make sure everybody knows that joining a Medi-Medi plan does not change what someone can get as far as IHSS authorized hours. It doesn't impact their IHSS provider. The main thing is that we want the health plan that's managing the D-SNP and the Medi-Cal side to coordinate with the county, so that if there's a hospitalization, if there's a discharge, something else that's changing someone's condition, the county and the health plan are aware and talking to each other to make sure that the members' needs are met. We know that there's continual work to make sure that counties and health plans are talking to each other and they have good points of contact with regard to IHSS and Medi-Cal plans. And so we want that to continue for dual eligible members who are joining Medi-Medi plans. For county behavioral health, it's a little bit different. It's more complex because most mental health and substance use disorder services for dual eligibles, mostly it's covered by Medicare. There are some benefits that are covered by Medi-Cal only, but again, we don't want the member to have to figure all that out, navigate it. We want the health plan to work with the county and on the backside, figure out any billing, crossover billing, all of that. Next slide. And community supports, you may have heard about that through Cal-AIM, and that's available through Medi-Cal plans. And because these health plans provide both the Medicare and the Medi-Cal piece, and they're already Medi-Cal plans, members who join a Medi-Medi plan can still get access to community supports. And then for care management, as I said, we have California Integrated Care Management through the Medi-Medi plan, and it's very similar to ECM. Next slide. One really important thing that often patients, members, consumers will look at when deciding if they want to enroll in any type of Medicare Advantage, including Medi-Medi plan, is what's the provider network like? And as Emily said at the beginning, that's like important work that her plan is doing right now, coordinating with providers, getting providers enrolled in a network, communicating. That is really important. And we have this slide because we know that when members join a health plan, of course, they want to make sure that they can see their doctor, have a good network, particularly, specialists, et cetera, that they may already be working with. And so we do have some language in the contract that recommends that the health plans do whatever they can for members who are joining who may have providers that are not part of the network. We want to have that health plan will reach out to the provider, try to get them to enroll in the health plan's network, and certainly they can make a one-off agreement. We want to encourage continuity of care for people who are joining these health plans. Another thing I'll just mention, it's not on the slide, but there's a new policy at the federal government on the Medicare side that allows people who are dually eligible to enroll in any month of the year, they can enroll in a Medi-Medi plan, and in any month of the year, they can disenroll from any Medicare plan and go to original Medicare, fee-for-service. And that's special for people, only for people who are dually eligible. People who are not dually eligible generally have to wait until the open enrollment period to change their Medicare plan or to go to original Medicare. But for people who are dually eligible, any month of the year, they can join a Medi-Medi plan, and any month of the year, they can go to original Medicare. You still have to wait till the open enrollment period for joining a regular Medicare Advantage plan. But anyway, the point I want to make is just that, not that we're encouraging people to, change plans every month or whatever, but that there is a good, there's an off-ramp if for some reason it's not working out. And there's an easy on-ramp any month of the year. Next slide. So the network adequacy requirements, this has come up in other forums that we've had, so we have a little more detail here on this slide. Again, sometimes D-SNPs, Medi-Medi plans, they may delegate to other kind of physician groups, et cetera. And sometimes the question comes up, well, is the Medicare network adequacy, is that at the plan level overall? Is it at the sub-network? And it is at the contract, at the plan level. So, and I should also mention that just to state the obvious, that these Medi-Medi plans, these D-SNPs, Medicare sets the network adequacy requirements. So Medicare monitors, Medicare requires plans to submit their Medicare provider networks. And so if there's any concerns about the network being inadequate, any problems, then you can contact the CMS regional office or 1-800-Medicare. But again, the network adequacy for D-SNPs is managed by the federal government, by CMS. All right, next slide. Crossover billing is usually a hot topic among providers who are serving people who are dually eligible. So one of the good things about Medi-Medi plans is it's the same organization that's administering both the Medicare and the Medi-Cal piece. And that means that the crossover billing should be much simplified. Providers can submit their claims to one organization, and that organization will process both the Medicare side and the Medi-Cal side. We do have some resources on our website for crossover billing. And another reminder that we want to flag is that balance billing is illegal under state and federal law. So for people who are dually eligible, they cannot be billed for any costs related to their Medicare Part A or Part B services. That's balance billing, and again, it's not permitted. And there are some small copays for prescription drugs, but for A and B, there can be no cost sharing for duals. Next slide. So how to join a plan? Of course, the individual has to have Part A and B Medicare, and they have to have Medi-Cal. They have to be age 21 or older, and they have to live in one of the counties where Medi-Medi plans are offered. Again, it's voluntary, and people can contact their Medi-Cal plan to join the corresponding Medi-Medi plan, or they can also call 1-800-Medicare. All right, next slide. Okay, so we're almost done with the slides and we can get to questions. So we at the state, we're doing outreach. We're participating in meetings like this all over the state. So when questions come up, what we say is please contact the health plan that is sponsoring this event. You know, in this case, it's Kern Family Health. But we also do have an inbox for questions, but we think it's really important to keep the dialogue at the local level because the health plan can answer all the questions. We do have fact sheets on our webpage, and we want to highlight too the importance of HICAP and the Duals Ombudsman Program. Those are really important for helping consumers and keeping in touch. Next slide. So this is just a recap of what options are available. So if you're thinking about, okay, what does this all mean? What are the options for duals? There's original Medicare plus the Medi-Cal plan. There's a Medi-Medi plan, which is what we were just talking about. There are regular Medicare Advantage plans. And again, the member would also be enrolled in a Medi-Cal managed care plan that might not match, might be a different organization than the Medicare Advantage plan. And then there's PACE. So for Kern County, we expect that Kern Family Health, Anthem Blue Cross, and Kaiser will offer Medi-Medi plans in 2026. And then the Medicare open enrollment period is October 15th through December 7th. And that's when people can select a plan that will become effective January 1st, 2026. Next slide. The last couple slides came up in other events that we've had, and providers have asked, well, what can I say? What am I allowed to say? What might I say? So we have a couple of talking points. What is a Medi-Medi plan? It has care coordination, one card, one number. There's actually also integrated appeals and grievances, but it's one entity that administers both benefits, and there are care coordinators who can help a member find doctors, make appointments, understand prescription drugs, get transportation, follow-up services, and enrollment is voluntary for a Medi-Medi plan. Next slide. And then there were more questions. And again, we have this information from the federal government. What can providers say to their patients? They can share the printed materials from CMS. Providers can share the names of the Medi-Medi plans that they contract with. They can talk about cost sharing, benefits, etc., answering those questions. Providers can refer members to marketing materials. They can only be in the common areas, the printed materials. Information about low-income subsidy for prescription drug affordability, and referring people to HICAP and the Ombudsman or legal aid. Next slide. And just a reminder that, again, from the federal government, that Medicare marketing materials cannot be shared in areas where care is being administered, like exam rooms or patient rooms, but they can be shared in common areas, vestibules, waiting rooms, etc. Next slide. Again, we have a lot on our website. There's 1-800-Medicare, there's HICAP. Let's go to the next slide. Lots of web pages here. I'll also say that we're having a webinar on July 29th at noon. You can find that on our website. And we'll be just, again, talking about the same thing from a statewide perspective. Let's go to the next slide. Okay, good. Melissa, I see you. I'll hand it back to you.
Great. Thank you so much, Anastasia. I appreciate the wonderful presentation. Emily, as well, thank you so much for opening us up. And thank you to everybody that called in today for the D-SNP presentation. A couple things. I know, Anastasia, you just mentioned about the DHCS webinar that's upcoming. Kern Health Systems will be producing a provider bulletin with that information. So in addition to checking out the DHCS website, just keep an eye out for those provider bulletins where you can find the registration information for that webinar. In addition, what we're going to do is, as you can see on my screen, there's a QR code where we can put in all of your questions. What we're going to do is we're going to post the PowerPoint along with this meeting recording on the KHS website as well. And then with any questions we receive, what we wanted to do is provide a kind of an FAQ for everybody that participated and then those that couldn't as well. So all of this information will be on the front side of the Kern website without a login required, so you don't have to log into the provider portal, just on the front-facing Kern Family website. So again, thank you so much. For those that don't know me, I'll introduce myself really quick. My name is Melissa McGuire. I'm the Senior Director of Delegation and Oversight for Kern Family Healthcare, helping to implement the D-SNP line of business in January. So thank you again so much, everybody, for attending today, and we look forward to your questions via the QR code and more to come. Thank you.